Hi everyone, and welcome back to another episode with Student Midwives. We are your hosts, Omneya,
And Layla.
and today we are back with another episode focusing on the CTGs. Before we dive into our topic, let's introduce a guest speaker today who all have different experiences.
Hi, I'm Kim. This is my first baby, and I'm here to find out more information straight from the source if I actually need a CTG during birth and how to find out what risks are, what the benefits are, and also what are my other options.
Hi, I'm Alison. I have 3 lovely children at home, and all my babies were born via normal vaginal births. I have had some exposure to CTGs in my pregnancies, but I've always had low risk pregnancies, as my midwives have told me, so I didn't really need it. So far, I've had all uneventful pregnancies.
Hi, I'm Petah, and I have 2 kids at home and have had 1 term stillbirth. I had a CTG strapped to me throughout my whole labour because I was told that I had to because of my stillbirth, even though looking back, I didn't really want it.
Thank you guys for sharing. So today we're going to go into depth of some of these women's loved experiences with CTGs and support them with education and develop decision making for their birth planning.
So I've been told my pregnancy is low risk, and I really want to know if I need a CTG. My sister had one, and she was also low risk, but she felt it wasn't necessarily needed.
This is the question all mums have. We'll first go into what is a CTG. It provides real-time data and continuous data on the fetal heart rate and your uterine activity. It helps midwives and doctors keep an eye on your baby and if they're going into any form of distress.
And if you are considered low risk and there are no other complications with your pregnancy or your baby, then you aren't really required to have continuous CTG monitoring during your labor. It's really your decision and it's completely optional.
Oh, really? So how will the midwife check if my baby is coping in labour?
During my labour, they actually used a Doppler every so often. It was discussed with my midwife before my contractions became more intense that they would be checking baby's heart with the Doppler every 15 to 30 minutes. I told my midwife I was happy for them to do this, and I told them they don't need to ask me every time they wanted to do it so I could just concentrate on the labour. I didn't really focus on it and I just stayed in my zone. Is this something that can still happen for women now?
Yes, of course. This is actually something that we call intermittent auscultation. It's recommended for all women who have low-risk pregnancies, so they don't have any identified risk factors that can result in things like fetal hypoxia, where baby doesn't get enough oxygen. It's done by either using a Doppler or a pinner, and we listen to baby every 15 to 30 minutes, as you mentioned in your labor, followed by every 5 minutes when you commence pushing.
I wish they offered me that. I felt so stuck to the bed during my birth because they had to keep an eye out for my baby because his heart rate kept dropping. But my baby was born perfectly healthy, so I don't think having a CTG on actually helped with my birth in any way other than cause me unnecessary anxiety.
Unfortunately, evidence does tell us that women often do feel this way. Most women feel that CTG limits their mobility and forms acceptance of the machine, and most believe the midwives pay more attention to the machine than them and their partner. However, there is a wireless and non-invasive CTG, which allows you to move around and reposition yourself more freely, and allows you to get in a hot shower or water bath, and if you'd like a water bath.
Well, that's good to hear if I was considering a water birth, but when will a CTG need to be used?
So, as mentioned earlier, both intermittent auscultation and CTG, they provide a baseline heart rate for baby. Although if you were identified with any risk factors, a CTG can be used. In hospital, we commonly, routinely put CTGs on if women present with decreased fetal movement or have conditions such as preeclampsia, which is high blood pressure in pregnancy.
So what if I don't want to use the CTG right away? Will you give me the option of beginning with a Doppler, and if anything arises, we can put on the CTG?
Of course. So CTGs can be put on women who have had a previous stillbirth, had meconium, spermidicta, which is basically when your baby opens their bowel when they're still inside. Women who've presented frequently throughout their pregnancy for decreased fetal movement and for breech presentation boards. You have the right to decline, but generally when you are considered high risk, we really want you to be reassured. So some mothers find that CTGs are helpful in these cases, and we can always revisit your plan.
So my friend recently had her baby, and she had a continuous CTG on and her baby struggled to breathe when they were born, would this have been related to the CTG?
So unfortunately, there's no evidence that shows us there's any real difference to neonatal outcomes when women have a CTG on and a CTG off. It does tell us there's an increased risk of instrumental births, whether that be forceps or vacuum delivery and C-section. So it's not directly related to the reasoning why baby came out not breathing, unfortunately. The CTG cannot pick that up.
Okay, I feel like I hear a lot now about how CTGs can help, but how can I trust how I'm feeling during my labour if the CTG says something else? I keep being told to listen to my intuition, but I'm worried I won't know because it's my first time.
You are not alone in feeling this way. It can be really confusing when you're trying to follow your body's instincts, but it's important that you trust how you feel during your labor. A CCG can be really helpful in high-risk situations. It gives us midwives a continuous understanding of how well your baby is coping with your labor and contractions. Although a CCG can misinterpret information into false alarms. So with that information, what are you leaning more towards? What's your instinct telling you?
I'm not really sure. I'm a bit conflicted at the moment. I think I'm leaning towards a Doppler to hear my baby's heart rate, and I also want to be free to move around to have an active labour.
Well, during my labour, I had a CTG on the whole time, so I couldn't really move around, which was frustrating. But my baby was born healthy and beautiful, and that was the most important part, even though my birth experience wasn't exactly how I wanted it to be.
I actually started my labour with what the midwives called a baseline CTG, and once they decided that it was normal, they took it off and then they only used the Doppler after that.
So do you think the CTG was helpful then?
I felt reassured having that baseline CTG at the beginning of my labour, and once the midwives were happy, I felt reassured to have it taken off and then only use the Doppler. But I also knew that if we had any concerns during the labour, either by the midwives or myself, we could always put it back on to continue monitoring baby more closely during the labour.
I liked hearing my baby's heart rate, but I couldn't move and was stuck on the bed. And to be honest, it did sometimes make me anxious hearing the alarm saying that I had lost the fetal heart signal, and then the midwife having to constantly reposition the machine due to my previous trauma of having a stillbirth. I wasn't aware before I gave birth of the option of not having a CTG strapped to me if I didn't want to have it. For my next baby, after hearing all this information, I will ask not to have the CTG on throughout the whole labour.
So hearing all of this, what if I choose not to have a CTG at all?
So if you choose not to use a CTG, as Omneya mentioned, it's completely optional, but it is a form of monitoring. So there is a risk that we may miss something if your baby is not coping well, which may lead to complications. But we're also not talking about using no interventions at all. So as mentioned, intermittent auscultation, using a Doppler or a Pinard, it's evidence-based, it's very appropriate in low-risk situations, and again, it can provide you with reassurance without being, completely strapped to the bed the entire time.
Okay, so that was really helpful. Thank you. Now I know the options and the reasoning behind them. We'll see how it goes. I'll be able to go home and talk to this with my husband. I feel confident bringing this up at my next antenatal appointment with my midwife.
Thank you all for coming in today and sharing your experience. And to our listeners, I hope this has helped you understand a little more about CTGs. CTGs are an important topic that you can discuss in your antenatal classes, so you can always make an informed choice regarding your birth experience.
Join us next week when we discuss breastfeeding versus formula feeding. This is the Student Midwives. Thank you for listening.